Well, you don't have to play a sport to suffer from what's considered to be a sports injury. We can injure ourselves doing all sorts of things, but we can see a sports medicine doctor because they specialize in fixing whatever it is we've pulled, torn, or strained. Dr. Jordan Lyles is one of those doctors. He's an orthopedic surgeon and sports medicine specialist with Arizona Sports Medicine Center. Thanks for being here.
Thank you.
We really can injure ourselves. I mean, we can just be walking and we can injure ourselves, so it doesn't really matter if we're an athlete or not. But I want to start with, what is Arizona Sports Medicine Center and how long have you guys been around?
Sure. So Arizona Sports Medicine Center, we are a specialist sports group in town. We've got a combination of joint replacement surgeons, sports medicine doctors, and surgeons.
Okay.
And we've been around for about 20 years.
Wow.
I joined our group 3 years ago after finishing fellowship.
Okay, so 20 years. There's some longevity here in the Valley. You guys have treated a lot of, I know, professional athletes and just residents in general. You have had a really unique opportunity. You've trained at Duke and the Steadman Clinic. You've also worked with Olympic athletes. So the very highest levels down to, again, just your weekend warriors. How has that experience impacted the way you treat your patients and how you approach sports medicine?
Sure. So the experience really has given me all of the tools necessary to treat the highest level athletes with the most complex injuries, but it's also given me the discretion to treat maybe patients with less requirements physically or different goals that don't always involve large surgeries or big long recoveries.
Okay, let's talk about the injuries that are most common that you're seeing in your office. I imagine it runs the gamut.
It sure does. So I treat shoulder injuries, elbow injuries, hip injuries, and knee injuries.
Okay.
And we primarily focus on injuries of cartilage, tendons, or ligaments.
Okay, and we were talking earlier, you say elbow injuries is something you're really seeing a lot of right now. What specifically are folks coming in with?
Yeah, so, unfortunately, elbow injuries have really seen a dramatic spike in the last 5 years or so. And we think it's due to the focus on velocity training for younger athletes all the way up to the MLB level.
Wow.
And so, I see a lot of overuse injuries, whether it's growth plate injuries on the inside part of the elbow, and even ligament ruptures and ligament sprains that sometimes do require surgery.
Okay, so this is an elbow, a model of an elbow. Talk to me about what specifically these tendons that you would fix most commonly for these athletes.
So for baseball players, especially pitchers, for example, as they go through the throwing motion, there's a significant amount of stress placed across the elbow joint, especially in what we call the layback position when they're getting ready to increase velocity.
Right.
And that's something that athletes really focus on to increase the speed of what they pitch. So the ligament on the inside part of the elbow here that goes from the upper arm bone to the forearm bone is called the ulnar collateral ligament, or some people call it the Tommy John ligament.
Yeah.
And that's a really commonly strained or injured ligament.
Okay, so you guys can use implants to fix that. You can get in there, whatever, like you said, it's very customized to what the goal of the patient is as well.
Exactly. So I will treat every injury uniquely based on the level of the athlete, the velocity of how they throw, their goals, their timeline. So, for example, I'll treat a 95-mile-per-hour pitcher from the MLB very differently than I'll treat a 16-year-old that throws 70s and just wants to get back for their senior year.
Right, or possibly continue their career. Okay, and this is the tool you use, obviously. I mean, we hear about Tommy John surgeries all the time. Yeah, and those overuse injuries. And again, kids starting younger with these sports, and the intensity of it is really growing, so to speak. So, yeah, keeping you very busy. Thanks for that information. Thanks for explaining what this was. I had no idea when you first brought it in. This is an elbow. Arizona Sports Medicine Center is located in Scottsdale at 8630 East Via de Ventura. You can give them a call at 480-558-3744 or visit asmcmd.com for more information.